Improving treatment outcomes. Strategies for better health. Improving treatment outcomes is a crucial aspect of healthcare, as it can significantly impact the quality of life and overall health of individuals. Effective treatment outcomes can lead to better health, reduced symptoms, and improved functionality. In this article, we'll explore the strategies for improving treatment outcomes and discuss the importance of a comprehensive approach to healthcare. Understanding treatment outcomes. Treatment outcomes refer to the results of medical interventions, including medications, surgeries, and therapies. The goal of treatment is to alleviate symptoms, manage chronic conditions, and improve overall health. However, treatment outcomes can vary depending on several factors, including the type of treatment, patient compliance, and individual response. Factors affecting treatment outcomes. Several factors can affect treatment outcomes, including 1. Patient compliance. Adherence to treatment plans and medication regimens can significantly impact treatment outcomes. 2. Type of treatment. The type of treatment, including medications, surgeries, and therapies, can affect treatment outcomes. 3. Individual response. Individual responses to treatment can vary, and some patients may experience better outcomes than others. 4. Healthcare provider. The quality of care provided by healthcare providers can impact treatment outcomes. Strategies for improving treatment outcomes. Several strategies can improve treatment outcomes, including 1. Patient education. Educating patients about their conditions and treatment options can improve treatment outcomes. 2. Personalized medicine. Tailoring treatment plans to individual needs and responses can improve treatment outcomes. 3. Multidisciplinary care. Collaborative care from multiple healthcare providers can improve treatment outcomes. 4. Evidence-based practice. Using evidence-based practices and guidelines can improve treatment outcomes. Benefits of improved treatment outcomes. Improved treatment outcomes can lead to several benefits, including 1. Better health. Improved treatment outcomes can lead to better overall health and well-being. 2. Reduced symptoms. Effective treatment can reduce symptoms and improve quality of life. 3. Improved functionality. Improved treatment outcomes can improve functionality and enable individuals to perform daily activities. 4. Reduced healthcare costs. Improved treatment outcomes can reduce healthcare costs by reducing the need for additional treatments and interventions. Common challenges in improving treatment outcomes. Several challenges can impact treatment outcomes, including 1. Patient non-adherence. Non-adherence to treatment plans and medication regimens can negatively impact treatment outcomes. 2. Limited access to care. Limited access to healthcare services and providers can impact treatment outcomes. 3. Complexity of conditions. Complex conditions, such as chronic diseases, can be challenging to treat and may require specialized care. 4. Healthcare system limitations. Limitations in the healthcare system, including lack of resources and infrastructure, can impact treatment outcomes. Overcoming challenges in improving treatment outcomes. Several strategies can help overcome challenges in improving treatment outcomes, including 1. Patient engagement. Engaging patients in their care and treatment plans can improve treatment outcomes. 2. Care coordination. Coordinating care among multiple healthcare providers can improve treatment outcomes. 3. Healthcare system improvements. Improving the healthcare system, including increasing access to care and resources, can improve treatment outcomes. 4. Research and innovation. Conducting research and innovating new treatments and interventions can improve treatment outcomes. Conclusion. Improving treatment outcomes is a crucial aspect of healthcare, and several strategies can be employed to achieve better health outcomes. By understanding the factors that affect treatment outcomes and implementing strategies to improve them, healthcare providers can improve the quality of life and overall health of individuals. Recommendations. If you're interested in improving treatment outcomes, here are some recommendations. 1. Seek care from qualified healthcare providers. Seek care from qualified healthcare providers who can provide evidence-based care. 2. Adhere to treatment plans. Adhere to treatment plans and medication regimens to improve treatment outcomes. 3. Stay informed. Stay informed about your condition and treatment options to make informed decisions about your care. 4. Advocate for yourself. Advocate for yourself and your healthcare needs to ensure that you receive the best possible care.